In our Vidant Spotlight this morning, I am very excited to meet Dr. Hassan Alhosaini because I can tell you I've been hearing a lot about this guy in my family. I won't go into details, but I'll just say that a while back I was asking a lot of people around Greenville, hey, tell me the new cardiologist in town that's getting it all done. And I kept hearing from people in the medical world that Dr. Hassan Alhosaini, who is fairly new, I think. How long have you been here?
Well, actually, I'm seasoned.
Oh,
So
you are?
I have been here for maybe on and off for 15, 20
Oh,
years.
have you really? I
But in
thought
my
you.
in my role
Yeah,
as heart failure cardiologist,
yeah.
I would say maybe 5, 6 years.
Dr. Hassan Alhosaini. I didn't do a very good
Oh,
introduction,
it's okay.
but
It's
it's
fine.
good. It's good to meet you finally.
Thank you
We
very
we
much.
also have one of your patients here, Tommy Walton. Tommy is from Fort Barnwell, which is over in Lenore County. Is that Lenore County?
Craven.
Yeah, Craven County. Yeah, it's kind of on Lenore-Craven line up in that way, isn't it? On
Well,
Highway 55.
8 to 10 miles.
I was telling Tommy that I used to try to find my way to the beach through Fort Barnwell and get lost back in those roads back there. We'll talk to Tommy in a minute, and Tommy is a patient. We'll talk about why he's here. But first, this is February's Heart Month, and of course we have the Heart Ball here in Greenville coming up on Saturday night, and we're very excited. Interbanks Media is very excited to be one of the 4 sponsors. We've been doing a lot of discussion this month about what goes on at the Heart Center, the Brody School of Medicine, and Vidant Health, and Dr. Alhosaini is doing a lot of interesting things over there. But I say this over and over again, Doc, but having what we have here in Greenville, Vidant, and the Brody School of Medicine is pretty amazing, isn't it?
It's amazing, and we are privileged and honored to serve the community, Eastern North Carolina. Heart disease has a staggering burden on the population here in Eastern North Carolina. Of course, nationally, not just in North Carolina. The risk factors for heart disease are prevalent: hypertension, diabetes, obesity, and patients present with cardiac symptoms and have cardiac issues. The hope is that we can prevent this from taking place to begin with. Raising awareness of risk factors of heart disease is a mission of the American Heart Association. The Heart Institute is proud to be an ambassador of the heart, supporting all the research and educational activities that American Heart Association is providing in North Carolina. We also are, proud to support the Heart Truth, heart disease in women, raising awareness of heart disease in women. February is an interesting month because it's the intersection of the American Heart Association Month, Heart Truth, and actually the Heart Failure Society of America awareness. And this is a time that you talk about it, promote the conversation, discuss how we can modify risk factors, how we can prevent heart disease to begin with. I think that's the key to success is heart disease prevention, and there are ample opportunities to do so. And and the Heart Institute, certainly with cardiologists and nurses and providers, aim to do that in Eastern North Carolina.
And we should mention that the Heart Ball, of course, is sponsored. It's an organization, an entity of the American Heart Association, and it's so important to promote it, which is why we got involved in it this year, because over $1 million comes from the American Heart Association to Greenville every year. And I've met some of the, not just you, but I've met some of the other doctors that are doing heart research, doing things with that money that come from the American Heart Association. So, unfortunately, I'm told it's sold out if you have not gotten in for the Heart Ball this year, but you can always make a donation to the Heart Association and other opportunities, as you said. You wear so many hats. You got like so many titles. I'm going to just get it for Dr. Alhosaini. He is the medical director of heart failure and mechanical circulatory support program at Vidant. Also, the cardiology director for the cardiac intensive care unit at Vidant. The East Carolina Heart Institute at Vidant Center, cardiology director. For ECU, assistant clinical professor of medicine, Department of Cardiovascular Sciences at the Brody School of Medicine. Is all of that on your name tag?
No.
You have to have a long
one
name
line.
tag.
It's really not about the titles. It's about being in the room with a patient and their families and loved ones, and talking about heart disease, the burden of heart disease, its impact on their quality of life and livelihood, the basics of how we can, conquer all the risk factors, how we can set in place the appropriate strategy to prevent admissions to the hospital, how we can improve quality of life, and how we can improve the survival with this, this deadly disease. And I find it very rewarding, when you sit down and talk with patients like Mr. Jones and his families. You learn a lot from them, and you try to, apply the science and the practice of medicine in a compassionate way that fits that patient's needs and goals. Oftentimes in medicine, there may be some disconnect between what the patient wants and needs and what we have on our agenda. So,
Well, I inferred that you were treating some people in my family. You were actually treating two members of my family.
am I doing okay?
Here's what
Give
I
me the
hear.
scoop here.
Because I sent one of them to you, and I said, I don't know this guy, but I'm hearing he's doing all sorts of cutting edge stuff and research. And then after the first visit, the response was, he's got a great bedside manner. He's but what I really feel is that he really cares, and he really cares about me. And I'm hearing that from other people too. So you're getting great reviews from patients, and you're doing some stuff, and you are doing some cutting edge research. Let's talk about Mr. Jones, because what kind of things, and I'll get Tommy to tell his story and how he ended up being a patient of yours, but what kind of things are you doing here that I keep hearing Alhosaini's doing cutting edge stuff here. What does that mean? What are you doing?
Well, and let me just preface by saying this: it's not just one, cardiologist or a physician. It's a teamwork. The team at Vidant is an amazing team. It takes a village to provide the world-class care that we provide in Eastern North Carolina. When you apply all the medical conservative treatments that you have, be it medications or cardiac rehabilitation or even simple procedures like stent or even more advanced treatments, and however the patient continues to struggle, the patient continues to have symptoms, and the patient is admitted to the hospital with acute cardiac conditions, then you pivot in your strategy and you try to provide more advanced care. Up until few years ago, the only way that you could provide this level of sophisticated heart care would be to travel 2-3 hours to our neighboring institutes and get for example a partial heart pump that will assist circulation. Well, we're fortunate now, again, because of all the resources we have, the support from Vidant and ECU. We're now providing advanced heart failure surgical therapies here in Eastern North Carolina. For example, there's a device called LVAD, or left ventricular assist device, which is a battery-operated partial heart pump that is implanted via open heart surgery that it improves patients' quality of life, keep patients out of the hospital. More importantly, it improves patient survival. And Mr. Jones was our first patient that we implanted this device in him, and Mr. Jones has done marvelous. Has done very well, and we're proud to have him with us here. And maybe
let me get him to come in. Tommy Jones again from Fort Barnwell, patient. You started. Tell your story. How did you end up knowing that you were you having a heart attack? What was happening with you?
No, I have congestive heart failure.
Okay.
And it was starting to get into latter stages. And then, when I got started with Allison over there at Vidant Cardiology, he came in, and then it just kept on.
So congestive heart failure, you kind of hear about that, and you say it gets progressively worse, right? I know a little bit about that. My dad had it. This LVAD surgery, is this something that slows it down or stops it? I mean, what does it do?
No, it's a pragmatic way to treat congestive heart failure. When medications fail to improve patients' symptoms, then you provide additional blood flow to the body, to
Right.
the vital organs, and essentially bypass the native heart muscle. The heart muscle is still ejecting, but it's not the sole provider of blood flow. And the partial pump is adding blood flow that will go to the muscles and give him quality of life, ability to do the things that he liked to do. And of course, it provides safety for him because congestive heart failure is a progressive condition, and it's inevitable that patients with congestive heart failure that will have progression of their disease. And LVAD now is able to support patients, lives really, and keep them out of the hospital and give them the quality of life that they deserve.
So when did you have your surgery?
It was in last May.
May of 16? May of 16?
2017.
17. So,
Yeah.
that's right. We're in 18,
Yeah.
aren't we?
Yeah.
So May of 17. And how has it changed you? Is it obviously it was successful?
I feel the best I have in many years.
Is that right?
Many years. I can do basically whatever I want to. You've got this stuff in the way and all that, but you can learn to live with it and that
Yeah.
type stuff and all that.
Yeah. So you were. I assume you had the classic congestive heart failure symptoms. You were tired.
Yeah.
Really not able to function when you get
Right,
to a certain
right,
point.
right.
And that's changed now.
Yeah.
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 That's interesting. That's pretty groundbreaking in and of itself. So this is LVAD, which stands for what? Left ventricle.
Left ventricular assist device. Historically,
Assistive device,
Yeah,
yeah.
historically, LVAD has been invented to bridge patients to heart transplant. But as you know, there's shortage of the heart organs, and not every patient with advanced heart failure would have the
candidate, yeah.
prospect for
Right, yeah.
transplant. So LVAD now is serving as so-called destination therapy. So patients live with it for the rest of their lives. And the technology now is miniaturized. The technology now is much more advanced, allowing for this durable equipment to stay with the patient for the rest of their lives.
How did you feel when you heard you were going to be the first person to get this at Vidant?
Well, it didn't bother me. It's like you said.
Did you ask Dr. Alhosaini, do you know what you're doing?
I was more concerned with owlware.
So it's a collaboration between
Yeah.
the medical team and the surgical team.
Right, yeah.
And I have to say we have one of the best surgical teams
Right.
in the
Do
nation.
I guess you don't generally do surgery, do you?
No, we do the medical side of it.
Right,
So
and we have the
help
world-class
patient
heart
selection.
surgeons here,
Yes,
yeah.
and we do the ICU care, the long-term care, and
Yeah.
but it really is a true heart team collaboration between the medical, cardiologist and the cardiothoracic surgeon.
It's amazing. I tell you, I've got a friend over there right now who just had heart surgery. A childhood friend who's. And I was over there this week, and I saw the sign with Dr. Mounsey up there, Erica, that who has just come here from Chapel Hill, who's doing all of the ablation surgery, and Dr. Alhosaini. The names that I hear, I mean, we just what's happening at the Heart Center here is it's just world-class stuff. I mean, I just can't say enough about what Vidant Health and ECU together are doing for the health care of the people of this region. It's unbelievable.
Yeah, again, we are really honored to serve the population of Eastern North Carolina. Heart disease burden is quite staggering, and I think simple interventions, risk factor modification, and smoking cessation, management of hypertension, management of diabetes, most of the time will prevent people from developing heart disease. But if they happen to develop heart disease and their disease progressed, we here at ECU and Vidant have the technologies and the expertise to handle their conditions. And
Well, thank you both for coming. And Tommy, it's great to see you doing so well.
Doing well.
Can you go out and mow the grass and all the stuff you want to do now? I don't know who wants to mow the grass. But
I enjoy mowing.
yeah. Well, actually, I can see that. Yeah. So you pretty much do what you want to do now?
Oh, yeah, yeah.
That's unbelievable, isn't it? And before that, you were you were headed toward being bedridden, I imagine.
Working on it.
Yeah. Yeah. Well, God bless you. It's great to see you, and you look great. And Dr. Alhosaini, God bless you and all
Thank you
you're
very
doing.
much.
My
Thank
goodness,
you very
this
much.
this is
My
a real
pleasure.
honor to have you in the studio this
Yes,
morning.
sir, my pleasure.
I've been hearing this name for a long time, so I was really glad when I saw that Erica was bringing you over this morning. And thanks to Erica Mizell, also from Vidant, who sets up all of our great Vidant segments here. Great to see you both, and happy Heart Month to both of you.
Thank you.
Hope to see you again soon. Tommy, I'm real happy that you're doing well.